Averaging outcomes across a patient population reduces the variability of the population mean. As the number of independent patient trajectories grows, the variance of the average converges to zero. Outcome diversification acts on moment estimates across the population. It does not alter the underlying failure structure of any individual patient. Organ redundancy changes the relationship between organ failure and patient failure. In a redundant biological system, the patient survives if at least one organ unit remains functional. This is a structural change in the clinical system, not an averaging of patient outcomes across the population. Organ failure modeled as an absorbing state cannot be reversed by averaging outcomes. Once a patient enters an absorbing failure state, future population averages have no effect on that patient. Positive expected outcomes across the population are irrelevant to a patient already in irreversible failure. Organ redundancy relies on the assumption that organ unit failures are independent. When organ failures are correlated, through systemic disease or common physiological cause, the reliability gained from redundancy is reduced. Common cause failures destroy the structural benefit of organ redundancy. Averaging outcomes across patients aggregates linearly. Patient survival probability aggregates nonlinearly. Adding redundant organ units increases patient survival faster than adding dependent organ functions in series decreases it. The two operations are not symmetric in their clinical effect. In a chain of dependent organ functions, each additional link reduces overall patient survival. As the chain of dependent functions grows, patient survival converges to zero. In a redundant organ system, adding units increases patient survival. The two topologies have opposite long-run clinical behavior. Organ redundancy provides no benefit under perfectly correlated failures. Outcome averaging provides no protection against absorbing clinical thresholds. Structural robustness depends on the topology of the biological system, not on statistical properties of outcomes alone.